Imagine when I was in Kuantan, once I had a case and the baby was just only as big as my palm. And then the weight was slightly more than this 500 mils of mineral water. Do you want to know what happened to the baby? At that point of time, middle of the night, the neonatal ICU team called me and then they said this small Prem 26 weeker, 565 gram. And then they realized the tummy was big, the child was not well. I attended the patient, and then when we saw the child, we did the x-ray, we realized the child has free air in the tummy. Generally the air will be in the bowel, dalam usus, udara dalam usus. Tapi budak ni punya udara is actually outside the usus. And then when you look at the blood semua tu, then we realize, this child might be having what we call perforated necrotizing enterocolitis, which is very common untuk baby-baby pramatang, very common for baby yang tak cukup berat, so high risk. And then this child needs surgery at 565 gram, which is like tak lebih besar daripada my tapak tangan. So this is where pediatric surgeon becomes very interesting. So generally when you think a child needs surgery, you bring the child to OT. But in a 565 gram, every movement can induce stress and add a lot of problem for the baby. So what we do as a pediatric surgeon, we bring the OT to the child. So we call the OT team, we ask them to come up, bring the instrument, everything. We create a sterile environment and we do the surgery in the NICU, in the neonatal ICU. And Alhamdulillah, I can tell you proudly, this is my 7th or 8th year. Every year, the mother will send me a birthday picture of the kid. So that is probably one of the most rewarding experience I have on the smallest baby I've operated. 565 gram, just slightly bigger than the mineral water. So don't worry, we can always do magic, most of the time, for any children. Okay, bye.